my name is Dr. Isaac Kreischer from Healthy Smiles and LaGrange, and today we're going to talk about what to do when you're missing one tooth. There are many ways to fix this problem. Some of the traditional ways that people have used in the past is a partial denture. This is a case where molar in one tooth is missing, but it's a similar thing. When you're missing a tooth, you have a partial denture attached to a metal clasps. You snap it on and you have to take it off at night. This works for some people. For some patients, when they have more than one missing tooth, it's a better option. But, some people don't like having to take off their teeth at night. Sometimes the people don't like the metal looks of the denture. So a newer technology is something called a valve glass denture. This is a little bit flexible. There's no metal attached to it, and it can just snap onto your teeth. And it doesn't really show too much. The drawback with this is that people still have to take it off at night, and it wears down faster than the metal. What people have traditionally used is something called a bridge. So in this case, you can imagine there's two missing teeth. When you do a bridge, you shave down one tooth, you shave down the other tooth. Afterwards, you take impressions, you send it out to a lab, and you get a bridge placed in there. There's no teeth on the bottom of it, but it at least can hold a fake tooth. The drawback with these is after about 10 to 15 years, these teeth start to wear down. So then you have to probably remove these teeth and extend the bridge even further. This is why, for this reason, I don't like to do bridges. So what is the other option? And many of you have heard about this, but it's called dental implants. What is a dental implant? A dental implant is a screw that goes inside the bone, just like that. This looks painful, this sounds painful, but something you should know is that the bone doesn't really have any pain receptors. So you screw the implant through the bone. You may be sore for about a day or two. Afterwards, there's one of two options. You can place a cap over there, sew it up, let it heal. In this case, after about 4 months, the cap is removed.
So why do you need 4 months? So you need 4 months for the implant to heal onto the bone. What happens is microscopic bone particles grow into the implant, and it takes about 4 months for that to happen. Once that occurs, the implant's going to be there, and there's a 95% chance that implant's going to be there the rest of your life. After that, after the 4-month period, we take an impression of your tooth, and we create something called an abutment. An abutment is a tooth that's kind of an analog to a tooth. Another thing that we'll do is after the abutment is placed, we'll either screw on or cement a crown. Once that happens, all you'll see is the natural tooth-like structure of your mouth. Will these be permanent? Yes. Like I said, there's a 95% chance this will be there the rest of your life. That being said, you have to treat it like you would treat a regular tooth. You have to floss between it, you have to clean it, you have to brush it. Long-term neglect, it's like getting a second chance on a tooth. The long-term neglect is going to ruin it for you. So overall, I really strongly recommend dental implants over most other options. It's a newer option available to the general public that hasn't always been there, and it's a great tool. You're going to have teeth that last you the rest of your life, and they'll be healthy.